Welcome back to my Saturday series on copying therapy, also known as Hijama. Last week we briefly introduced copying therapy, and then I mentioned there is dry copying, there is wet copying. But then when you hear the word copying, you don't want to know, okay, what is it that is being used to do this copying? How is it being done? So this is what a set of cup looks like. You have cups in different sizes. This is a set of 24 cups. You can have a set of 12 cups. So you have the cups in different sizes. You have the big one that can be used on wide surfaces like the back, like the thigh, like the buttocks. And then you have the smaller ones that we use in smaller areas of the body. And then remember I mentioned we have a suctioning device. This is how it looks like. And we use this for massage and all. So for cupping, I mentioned we have dry cupping and then we have wet cupping. In case of wet cupping, small incisions are made and blood is being drawn out, while in case of dry cupping, no incision is made. So this is how it works. You have your cup. This is a small size. I'm using this to demonstrate. And then you have your suction device, and then you just place it on the skin and then we suction. So when you hear cupping, you may have gone online to read some things, see some dark circles, red circles, some blood, and you just feel scared like, okay, how is this? So I just thought it's nothing scary, it's nothing bad. So this is it. This is having a firm grip on the skin of the person. So we can leave this for some minutes depending on what you want to do. At the same time, this can also be moved around. I can move this depending on why I'm doing the cupping, which we are going to be talking about in subsequent episodes. But then we can move it around. We can leave it at a spot, right? And then we can cup it like this, leave it for a while, and then remove it and make some small incisions. And in that case, it becomes wet cupping. So this is what cupping looks like. It's nothing so scary. It's not a major surgical procedure, although it's a sterile procedure, especially when you're doing the wet cupping. You want to make sure that the person doing it for you is putting on his or her hand gloves, and you're doing it in a sterile environment, in an environment that is actually designated for cupping. So you don't want to take chances at all. It's a sterile procedure. So this is how it looks like. In our subsequent video, we'll be talking about conditions where cupping is needed, how cupping actually works scientifically. We're going to be talking about it. So stay tuned. I'll see you next week again in my next video. Bye.